This is a plain CT scan of paranasal sinuses of a 25 years old female. Please observe these hyperdense masses which have occupied whole of the right ethmoidal sinus, right frontal sinus. It is extending across the midline onto left side. Please observe thinned lamina papyracea which is displaced laterally. None of the walls of the air cells in right ethmoidal sinus, they are visible. Just see the eroded bone here. It is the posterior wall of right frontal sinus, and the mass extends into the lower part of right anterior cranial fossa. In the region of orbit, this is the medial rectus muscle which is displaced laterally. Although right ethmoidal sinus is grossly expanded and right lamina papyracea is eroded, but it is still well contained, and there is no intra-orbital extracorneal extension. Now, at this level, right eyeball is compressed and displaced laterally. I scroll it down. This is right nasal cavity. Just see the mass extending into the anterior part of right side of nasopharynx. This is right maxillary sinus. The mass projects into the middle part of right maxillary sinus. Anyhow, there is no extension into right maxillary sinus. Right maxillary sinus is opacified. Now I will show you the coronal scan. This is the coronal scan here. I scroll it back. Please observe this mass. Right inferior and middle turbinates, they are not separately identifiable. This is right inferior concha which is displaced laterally. It is thinned. This is the site of the right maxillary ostium. The mass projects into the middle part of right maxillary sinus. Osteomeatal complex is eroded. This is right sphenoidal sinus. I scroll it anteriorly. Please observe that right cribriform plate is eroded and the mass extends into the lower part of right frontal sinus. At this level, the inferior wall of right frontal sinus is eroded and the mass projects into the supramedial part of right orbit. Right eyeball is displaced downwards as well. Now I will show you the sagittal scan. Please observe eroded posterior and superior walls of right frontal sinus and the mass extending into the lower part of right anterior cranial fossa. Cribriform plate is eroded at these levels. Now I'll show you the bone window details. You will better appreciate the erosions of bones. This is a case of sinonasal polyposis with superadded fungal infection. Normal sinonasal polyps, they do not erode bones in this way as they are eroded here. So it is the superadded fungal infection. Appearing as hyperdense areas, and there are thick inspissated secretions as well. Just see the wall of frontal sinus eroded, the mass extending into the floor of anterior cranial fossa. Please observe expanded right ethmoidal sinus, thinned cribriform plate, and laterally displaced medial rectus muscle. This is the superior oblique muscle.